I am Dr. Melia. I'm a trained orthopedic surgeon and did subspecialty training, particularly for spine surgery. We are using this center as not really a clinic. This is a lifestyle center. Right now, we're marketing this as an orthopedic, a lifestyle, and a wellness center. So we just don't treat you as if you're a patient needing our service, give you medications, and then you're gone. Pretty much for me, it's really a lifestyle. So we do some bike fitting in this center. We also have my cousin who's a chef, is managing our cafe, offers healthy meal options for our patients. We give them a diet modification together with the chef. That's also palatable enough for the patient to shift to a particular diet. Frankly, what we are trying to really sell here to our patients is that we maximize conservative management. You have to maximize pain medications, physio, proper physio, maybe injection procedures, which we do a lot here. Generally, if you do these, you would get away from surgery, right? So the point is, we try to maximize the non-surgical option. Patients with arthritis are very much welcome. And all of us will reach to a certain point to this level. The osteoporosis problem is getting bigger and bigger, especially in Asia. Treat everyone VIP because to me, even if they're indigents, even if they can afford, everyone's VIP. That's why we go the extra mile, because probably they see that I'm also doing this to them. Right now, I lost count already of how many insurance companies are attached to me. So it's more than 50 insurance companies. So we basically had our accreditation based on the qualifications as a doctor. So right now we're in the talks of having the accreditation for the center. We're trying to promote lifestyle. It's a hard work to become fit. I can attest to that. But there's a formula to that. We can share that formula. That's something that is not discussed in a normal clinic, I guess. That's why we removed the clinic from the equation. I think there's a drive in me to, I think in every person, that we want to be significant in this world. If we have to go maybe at 60 or 70, at least we did something good before we go, right? And it has been part of me ever since. I'd give credit to Dr. Edgar Eufemio. He's a sports surgeon from Manila, and I was mentored under him in UPPGH, and he gave me this idea that you have to maximize all the conservative management, and part of the conservative management is the lifestyle. More than 70% of the diseases that we see in aging population are diet modification, whether it be osteoporosis, whether it be the arthritis. These are diseases that we can modify in terms of lifestyle. Whether you do strength training, you modify it with flexibility, you modify your lifestyle with food intake, then you don't get arthritis over your knee. So these are stuff that normal clinics, I guess, don't offer immediately, because it's very easy to write a prescription drug and then you're gone. Patients are probably one of the reasons why they are afraid to go into a clinic, right? That's why the concept of going outside the hospital and establishing a lifestyle center is that you just don't come if you're sick. You can come when you're not sick. I want to see you when you're not sick. I would think that the physio that we do here is geared towards movement. That's why we named it Movement Lab, is the reason why we want our patients to move after the session. So even if you don't have any disease, we catch you. That's what we call prehab. So even before the injury, we can orient you can orient companies to give them a good idea on the proper ergonomics, how to sit down, how to set up the workstation, and then prevent further back injury. So it lessens the the leaves of the clients, right? So lesser headache for the HR, right? So we can offer that here. Number two, the workplace injury. So a lot of work these days are sedentary, sitting down. I get a lot from the call center business. They would experience back pain. Why? Because the ergonomics of the computer, the ergonomics of their chairs are not really designed for them, probably. I mean, a simple advice that you need to stand up every 45 minutes, we're not even enforced. I mean,
Yes.
you just have to remind probably the HR to give them a break every 45 minutes or 1 hour, and you'd save a lot on the absences, right? And the other market would be osteoporosis. So since we are an industry-driven city, wherein most of the people now stay in buildings, in malls, and whatnot, the osteoporosis problem is getting bigger and bigger, especially in Asia. So this one, I guess, even if I ask the regular 60 plus years old and above, it's not part of a regular executive checkup. And why is that? Why is it not part of an executive checkup for a 60-year-old? When in fact, I know that you're in menopause. And when you hit menopause, 5 to 10 years after, I'm sure you'll have osteoporosis. So why is it not part of the executive checkup, right? So these are ideas I also gathered when I was training in Korea, in Italy. So you get snippets of everything and then offer it here in our center. I invite you guys to visit Asian Orthopedics Spine and Joint Center. We are located at Jamestown Center in Mandaue. And feel free to come here for lifestyle modification. We have advice for diet, strengthening. We can give you coaching for triathlon, and of course, if you're in pain, you can definitely count on us.